The fourth annual Niagara Infant Mental Health Symposium was held recently. Much of the event focused on the release of data surrounding a 3-year study on infant mental health called the Ages and Stages Questionnaire.
And we've learned a lot about the kids in this region. I think we could learn more, and I think we could do better. But given that we had literally no funding to do a qualitative study is pretty remarkable.
How do you think the findings will be used? What happens after today?
Yeah, and I think that is a really important question for the community, and that's what we're going to be asking them too, to be honest with you, is where do you want to go from here? Because I think they're ready to start looking at a more rigorous study with a greater level of commitment from the agencies involved.
Ages and Stages questionnaires were turned over to Dr. James Reynolds, who interpreted the data.
And what somewhat surprised me, that shocked me a little bit, was that about 40% of the kids who have been screened here are showing evidence of developmental delay or at risk of socio-emotional delay, delays amongst several domains of function. That I was really surprised to see the numbers were so high, and it tells us a lot. It tells us that there are vulnerable kids in the community that need help, they need support, the families need help and support.
Amongst those taking in the session was Dr. Andrea Feller, the Associate Medical Officer of Health. She cautioned against reading too much into the 40% number.
That's what we expect when we're doing a screening tool that is designed to catch as many children as possible, but not potentially as accurately as possible. We're going to have what's called false positive, a lot of false positives. The other aspect of it too is that these are children of all different ages, very, very young children. So a lot of them may already be about to be screened by their doctor, be about to be caught by their doctor, and we just happen to be catching them early.
Dr. Kulkarni and Dr. Feller are firm believers that delays in development must be noticed and addressed.
We're facing a crisis in mental health with our youth. We're seeing numbers that we've never seen before. And what, parallel to that is research that is telling us that what happens for those youth early in their life, whatever their early life experiences were, may have had a significant impact on those outcomes that they're experiencing. So we have to dial back. If we want to change the story for the next generation of youth, it means we have to start right from the moment they're born.
We're also really learning that some of these issues that in the past we would say, oh, boys are just being boys, or that's just how they are, that really they might be a sign of a little bit of a delay, especially social emotional, and reaching out to your early childhood educator, reaching out to your trusted child care provider, reaching out to public health and our family home visitors and our parent talk line. That's something that's happening more and more in this community, and it's becoming the norm. So I think the key message is really we've got this huge group of folks that are part of that village.
One thing that was identified was the need for more post-screening follow-ups in Niagara. Those involved will also work towards having a research contact at participating agencies in the hopes of continuing to advance the Ages and Stages project. In Niagara, you're watching The Source.